Don't overlook this one really elusive parasite if you want to recover from chronic illness. Hey everyone, Dr. Tom Moorcroft here, and welcome to this episode of the Lyme Insider. And today, I really am excited because we have a very special guest, Dr. Ebony Cornish. And we're going to be talking about that one parasite, that one little hidden bugger that might be holding you back if you or a loved one happens to have, chronic infections. Often seen with tick-borne infections, or even other people who think they have tick-borne infections and turns out they don't. And this parasite is Toxoplasma gondii, and it's one that we think about a lot right around the time that someone might be getting pregnant or delivering a baby, but it actually can have broad-reaching effects for men and women out of all ages. And one of the things we really have to think about are the neuropsychiatric symptoms that may come from an infection, including things like psychosis and even schizophrenia-type symptoms. So in this world where we're talking about chronic tick-borne infections, looking at infection-induced autoimmune encephalitis, often called pandas and pans, at least in our kids, one of the things we have to think about is it's not always just tick-borne, right? So sometimes there's an overlap between many of them, and sometimes there's other things going on where it's only some other infection and not a tick-borne infection. And really, that's part of the Lyme Insider. We want to dive in. We want to get those guests that are going to help you find out what's truly wrong with you so you can start getting better. Because after all, it doesn't matter what the name is. We just need to know it so we can help you get better. So in this episode, Dr. Ebony Cornish and I take a deep dive into things like toxoplasmosis, as well as all her work at the Amen Clinic, doing SPECT scans of the brain, looking at where different infections and different psychiatric conditions can decrease metabolism and cause changes in your brain, and different approaches to take to actually reclaim your health through that methodology. So it's really about getting the accurate diagnosis first, and then we can dive into those treatment approaches. So I'm really excited to have Dr. Cornish with me today, and I hope you really enjoy this. Now, one quick note here. I was at the March 2024 MAPS, a Medical Association for Pediatric Special Needs Autism Conference, and both Dr. Cornish and I were lecturing. So as soon as I heard her talking about toxoplasma and all the other approaches she takes, I knew I didn't want to wait to get this information in front of you, so I grabbed her and we sat down in the hallway. So the audio quality would be pretty good, but it's not going to maybe be as good as it always is here in the Lyme Insider. But more importantly, we got you that guest right in the moment when we can really have a deep dive into the most important things to help you get better soon. So enjoy this episode, and thanks so much for joining us.
Ebony, thanks for joining me today. I'm really excited for our conversation, and thanks for taking time out of MAPS here because, great conference, and I loved your lecture on toxoplasma, and so just hoping we could have a bit of a conversation about what you've been seeing clinically.
Of course.
See where it goes.
Yeah, you're amazing. So this is, why wouldn't I come and spend time with you? Tom, you're like the best man I know out there treating these chronic kids, and that's why I love MAPS too, because I get to hang out with people like you.
Oh, nice. Yeah, I love it. We're having a really good time here at the MAPS conference, and that's the Medical Association for Pediatric Special Needs. And so Dr. Cornish here was lecturing. And so one of the things that like I love, like you said, is we get to come together and be a part of this community. But what are you seeing in your private work? Like, what direction are things going in terms of any new ideas or concepts for getting through this, chronic illness thing that we keep working with, and where are you headed?
I think the biggest thing I've added to my practice right now is looking more at oral infections. Like, I'm finding parasites in the mouth, like Influenza, gingivitis, and I'm like, oh, now I got to add another layer on top of my vector-borne diseases, as well as my Toxoplasma gondii, which I'm seeing a lot more patients present with. But I think most importantly, Tom, is when I'm understanding brain activity, being more involved in understanding what basal ganglia, encephalitis looks like, and how it can look better as a person gets better with treatment by using SPECT scan imaging. I think that just changed the game completely for me, because I was like, oh yeah, I deal with neurological infections, but I really wasn't getting a look at it. It's kind of cool.
Right. So, what are the things that you're seeing? Like when you're talking, what are you talking about when you say neuroimaging? What are the specific things that you're looking at?
So, SPECT scan is like a 3D look at kind of your brain, right? So it's like if I took your brain out, I put it on a table, and I just looked at it. So it tells me, okay, this is how much blood flow you have.
Right.
This is how much activity you have. You either have too much or not enough. So I look at it because Dr. Amen's work, it started with NFL players, and now we're transitioning to toxicity. So I'll say, okay, Tom, your brain, has what we call a little scalloping on the parietal lobe. That might mean you got a toxic brain here. Let me do some more digging. And then I look, flip your brain over, and I'm looking at the deeper levels, and I'm like, oh, wait. Now look at your basal ganglia. They are hyperactive, so you might have some sort of toxicity going on. And then I look at like the prefrontal cortex, is like I turn your brain over and look at the front, and I'm like, ooh, what is this executive functioning doing? Right. Then I might look at the side of the brain, right? That's called the temporal lobe. So now your brain's upside down, and I'm looking at the side of it. And that's where I get the most information from my kids here. My, pediatric patients with autism, because that's the area of the brain that deals with language, that deals with memory. So I kind of know before I see a patient come to my office, a little idea of what I'm going to be dealing with. Right. So, yeah, I get an understanding of that.
Super cool. So when you're starting to see some of these changes in the brain, like you said, are these things that are just is it a one and done, or is it like you can actually figure out what the underlying trigger might be, treat them, and then see this improve, or what are we looking for?
Yeah, so that's the cool thing, right? Because before I would just say, oh, they have neuroinflammation, they have neurological Lyme, they have pandas, it's all, neurological. But then when I look at SPECT scan, it tells me that I need to do intensive management. So that's kind of why I created this intensive program, Amen, where you come for 2 weeks. I'm like, ooh, your brain scan, I can fix this. So what I can do is look at the scan abnormalities, see that this is a toxic brain, then I kind of know what tests I need to think about, all right? It doesn't tell me what exactly it is, but it kind of tells me what questions I need to ask, right? Nice. And what area of the brain might need a little more loving, a little more support than others, all right?
So after all, it's all about love.
We're giving some love to anesthesia. I love the brain, right? Because I was a neurology major at Brown, so that's like my thing. I've always loved the brain.
Right.
So, and then the best part is when they get another scan after the treatment is done, right? Or even during treatment. So I have some patients, I'll get their brain during treatment and it'll be more hyperactive. Like the basal ganglia, the limbic system, the prefrontal cortex is like on fire, right? Because we're looking at activity. And I'm like, ooh, maybe they had a Herxheimer. And I've seen them like, maybe that's what they're going through. Maybe that's why their symptoms are worsening. And then it tells me I need to focus on detox. So it really gives me an idea of what to go. Not to say everyone who sees me needs a scan, right? I treat people without it. But when I do have it, and I'm thinking, oh, it's so awesome.
Well, it sounds really interesting, too, because a lot of times we're always asking, what is going on here? Is the person having a medication side effect? Are they having a Herxheimer? Is this going to help get better? And so if you have the opportunity to look into that, that's pretty remarkable.
It is. And a lot of other doctors use it. Remember, Kurt at the beginning of his lecture talked about how it was helpful in his management. And we get that referral from other doctors all the time when they're like, am I stuck? Like, is this still neurologic? And the cool thing is sometimes I've found patients where I'm looking at their brain and I think I'm stuck. Like it might be stuck with a Lyme person, stuck with this person. I have their brain already. And then after treatment, after I do so much treatment, I'm still stuck, right? And then I might say, all right, let me really get a post-brain scan. And then they're like, have evidence of traumatic brain injury or, prefrontal dementia. So you can see different patterns.
Right. So are we seeing like, hey, somebody had a TBI and somebody has tick-borne illness and it looks different?
So it's more like someone has a TBI and then it's different from inflammation or toxicity. So it doesn't say this is definitely, Lyme or mold, but it'll show me if it's inflamed or not. That's what we call scalloping of the parietal lobe. So it's like an imbalance of colors, because that's what SPECT scan is. It's like different colors and activity level. And that's when they say, like even working with Dr. Amen, like, look, figure this brain out. It doesn't look like it's a psych issue. But the trouble is when I get stuck and then I get the image and the person's like, oh, I forgot to tell you, I had a motor vehicle accident. Or I played football for 40 years when I was 20. And I'm like, well, it's partial Lyme, but a lot of this is concussion, or brain damage or something else. And that's what I find is really helpful when I'm looking for the next step. Like, okay, we can only treat the infection for so long, right? I'm not going to get you on treatment for 20, 30 years, 40 years. I'm not going to do that. But then if I get stuck, I need to look at what the brain's doing, especially if it's neurologic symptoms.
Yeah, I think it's so interesting, though, that we can start to have a conversation about, is this inflammation, is this old like TBI, is this maybe more of a psych presentation? Because that's a question so many of us always have. It's like, what's going on? Yeah.
Always.
So then, clinically, you have this diagnostic tool, and you have so many people who refer to you for that expertise. What are you seeing kind of like, I'm just saying like your general clinical practice, maybe even without the SPECT scans, like what's come up and what's really moved the needle for you? Because I know that you're one of the people on the forefront trying to figure out how to make this quicker and easier, how to get the best diagnosis early on. And I mean, I was really kind of blown away by your talk about the new stuff that's coming up. So I'd love to share that with everybody and let them know what's happening.
Yeah, so typically with my patients, right, because I treat vector-borne diseases. I treat, autoimmune, pandas, parasites. I even treat Morgellons disease. So I have a broad range of patients. But just like with you, Tom, we're never really that first doctor. They come in with 7 binders worth of tests, and they're from our friends, right, who are in the field, who have been in the field longer than us or as long as us, and are doing all the work. And so I'm like, well, what else? Why are you still sick? And so I asked that question to myself, like, okay, maybe it might be parasites. And that's how I got into looking more at Toxoplasma gondii, because when I used to test it, I'm like, oh, no one has it. And then I start seeing a lot of these patients being sent to me, and I'm like, something's missing. Something's up,
right.
You're not just having schizophrenia. You're not just depressed. Something else is going on. You've been tested and you've been treated. So yeah, we're going to treat, your Bartonella, your babesiosis, your Borrelia. We're going to treat that. But then we're going to look at these parasites. And so that was a game changer. And then the most recent game changer, because they say, don't keep testing, you're going to find something, right?
Right.
The most recent thing is now I'm looking in the mouth. I'm getting a lot of oral DNA. I'm looking at different, parasites in the mouth, right? Entomoeba histolytica, and also, Fusobacterium. So I'm seeing a lot of these pathogens now in the gums. And I'm like, oh, maybe that's where I need to go. So then I create like special mouthwashes or dental paste, because now I'm looking at the mouth, right? And that's a missing piece. No one's looking really there,
I know.
Parasites in the mouth.
Yeah, it's like, I think I've heard like Bredesen talk a little bit about it, but it's like this direct communication back up into our brain. So are you finding that like, what's treatment like? You mentioned a few things, but like, if I were a patient coming to see you and I'm like, or a doctor trying to figure this out themselves, like, what is all this testing in the mouth, and like, how are you actually going about creating these things? I mean, is it a specific compounded, like toothpaste, mouthwash type of thing, or is it just kind of like you're just, you have some over-the-counter favorites, or where are we going with that?
So this is how it works for me. This is what I'm using right now. So I am using a lot of DNA connections.
Okay.
So they have this floss test, and I learned about this from a biological dentist out in California that I used to collaborate with. But in the last year, they've developed a dental floss test. However, the caveat is when you get the results, because it's looking at DNA, you're going to see tons of pathogens because our mouths are dirty, right?
Yeah.
It's filthy. How does our gut get filthy? Our mouths are dirty as well. So we have numerous
microbes. Good.
Yeah,
we need that.
We need it, right? But we have so many, and so I'll get these reports, and patients come to me like, oh my gosh, I take my gums out my mouth. Because like about every pathogen, there's like 30 pathogens on this report, and most of them are normal. And then as I started doing more research and going to these conferences, I remember at ILAS last year, someone did a really great talk on the oral microbiome and what's toxic or not. So if I find something, like I said, especially with the Fusobacterium or the Entomoeba, and then these kids, when I'm finding strep and different strains of strep in their gums in biofilm form. So then I have to get creative, right? I'm still figuring out the magic, but I'll do a lot of biocidin, dentalcidin, and I also do I'll create a formula with a compounding doctor based on what I find. So may it be a compounded form of Alinea and Crypto Plus and the statin all mixed together, you know, and then they gargle with it. So it's like a gargling thing, and then they swish it for about 30 seconds and spit it out. And then I have some patients, when I was first doing this test, like in January of last year, they want to get tested afterwards. So it helps me, right? Because some patients want it, and you see the changes, so you kind of perfect the mouthwash and get it as best as you can. So it's still a process and evolution, but it's pretty awesome. It's pretty cool.
I just love the concept, because we're talking about, like, you and I see a lot of pans and pandas.
Right.
And when we're doing that, like, to me, I'm like, oh wait, recurrent nasosinus sort of infection with strep is probably the one of the main ways we get pandas.
Yeah.
And all these other things, like I'm thinking about mold in the nasopharynx and how chronic infection can do it. But the other part is like this whole oral microbiome, and it's not just the inflammation going to the brain, but now you're talking about identifying the pathogen and treating it. And I love using things like biocidin. A lot of times I'll use a dental and I combine it with, some other toothpaste from, Primal Life Organics or whatever to just round everything out for just
and
the
BioPure, they have a good paste, gum paste.
Right. And it's like, so we've got things with clays and essential oils, and then we've got these antimicrobials. But I just think, I love the idea of the gargle too, because so much of what I used to learn was all about, it's on the tonsils, if you still have them, or in the crypts, and then you maybe I gotta go get them like frozen in Europe or something. But here we have products that you mentioned and others that are known to break through biofilms, and that's what's keeping the good and the bad stuff, but now we can directly go after that. So it's kind of brilliant shit.
Yeah, it's so much fun. And the beauty of it is kind of with strep, when we're dealing with strep and anal strep and tonsils, and you get everyone's adenoids out, you get the tonsils out, the anal strep is resolved. Then you're still getting that ASO, you're still getting that anti-DNA, it still comes back positive. And that was my issue, that was my frustration, that I didn't know the source. Like, where were we finding this?
Right.
And that's where the gum paste became so helpful. Now, do I get non-compliance? Or do these mouthwashes taste good? No, they don't, but they work. So it's like I'm still trying to find that mix of things that's more palatable, but they work. That's the thing. And a lot of times it's trial and error, but the trials are good. And I'm really happy about venturing off into it, just like I was about looking at the brain.
Right. Well, and I think that the thing that I keep thinking is, how do I get, what's so cool about this for patients? It's freaking easy.
Yes.
Right? You're brushing your teeth. So maybe we change the flavor. It's a little gross, and some of our kids might need a special formulation of the special formulation because they're so, sensitive to it.
Yeah.
But for most people, this is low-hanging fruit of a practice you're doing every day, multiple times a day, that can make a huge difference. So nice.
It is. It's like you were mentioning earlier with the nose. If we're not looking in the nasopharynx, if we're not doing our nasal cultures and our testing, we don't know the microbes that live there. So now we have to look in the mouth.
Right.
And the brain. Right? It's all neurologic. We got to think about it. We got to think outside the box because, like us, we deal with so many people who are suffering. They've been to so many other doctors. So you really got to take your detective hat out. And that's what I do a lot. It's like, okay, what next? And that's where I have to get into some of the out-the-box cool things. That just makes sense. This is logical, right?
Very cool. So then if we're working on things like in the mouth and we're talking about the nose, are there other major areas that you're finding that either really changing the direction of your practice and the results you're getting, or something that maybe some of the referrals that come in people are missing? I mean, is there something out there that our listeners can be like, I should be checking that one out?
Right. So it goes from up here to down here. So, so I'm getting, like I said, a lot of the parasitic infections, the gut dysbiosis, because a lot of my patients who come to me have been on numerous antibiotics beforehand, numerous antimicrobials, so their gut microbiome is really deficient, especially with bifidobacterium.
Right.
So I'm kind of building up that specific organism in their gut and finding some benefit. And then the biggest thing I find people are missing with the strep is the anal strep. People aren't looking there. So you got to look below and you got to look up top. And that's kind of the big things. And then, of course, the environment. But fortunately, a lot of the patients I meet have already had that test. Have already had the doctor work them up for the environment. But those who didn't, that's kind of that missing piece as well. Looking for the mold, looking for the metals, that other parts outside the box that might, not just the infectious, okay, because we treat that too.
Yeah. So it's interesting that you bring up perianal strep and other things, because I actually have a few people, some of the hardest cases that until you start to treat that, it doesn't change. But you may be the only other person I know who's actually said that beyond the neonatal period. So.
Because, is it comfortable? I'll never forget.
Hey, I'm going to stick a Q-tip, to
a 15-year-old or a 6-year-old, right, who comes in and you're like, it's somewhere else. And then you got to think about, if it's itchy, is it perianal strep or is it some sort of pinworm? I mean, I get into all those kind of things. It's down this rabbit hole. But the perianal strep was like, when I found that a few times and did the little, I was like, yes, that's where it was.
Yeah, and it's like these families will pass strep back and forth, and you're like, well, where is it? And obviously we know they're not licking their mom's rear end or whatever, but I have a family, like, literally, like, mom's like, I've got this perianal strep. She had a culture from somebody a long time ago, and she's like, it kind of got better, but then things all came back, and I wonder if that's it. We retested her, and lo and behold, she has it. It's like when you change it, like, we saw her kids sort of re-triggered ring events kind of really get much lower.
Yeah.
And less frequent. So, but what are you doing? Like, I mean, in terms of like treatment, is it just antibiotics and topicals, or do you have?
Yeah, so I'm doing a lot of the herbals, a lot of, I'm trying to, once again, it goes to being creative. So definitely, of course, antibiotics, definitely. Right. And trying to find topical treatments. Like in some of my patients, surprisingly, I found that topical dapsone. It's so cool the things that we use when we're trying to create other answers. Of course, I'm using the topical, like making the penicillins, right? You're using that, but you're placing the topical. But I was like, whoa, like.
Dapsone.
Yeah, who knew? Because, it's a topical form. Or I'm using topical. It depends. It's so many options out there. If I gave you everything in my arsenal, we'll be here for like 4 hours. And some of the people say, what? But, I mean, it works. It works. But I use a lot of herbals, too. A lot of herbals.
Oh, my God, yeah. And it's like some of these things you can, like, add people with different rashes anywhere, and it's just like, and why not perianally?
Yeah.
It's like, you just put these sort of liposomal formulations on things and doing great work.
Yeah, they might feel a little weird telling you about it, but, especially I use a lot of the liposomal biocidin. I'm sure you use that as well. I use some of the Vanderall, the Cumanda, so I get a lot of the Nutrimedics.
Yeah.
And then, it's just awesome when you see that go away and you find that it was something that easy. Because, sometimes, Tom, what we do, we're treating the body. We're treating the human body. Mm-hmm. We're treating the brain. And those systems can heal, right? And then sometimes I'm like, this was easy. If we just kind of, even when we talk about the lifestyle piece, that's easy. And then you start looking at the treatment, and you're like, you take a step back afterwards. It's like, if I would have just looked at that person's mouth, or if I would have just tested that person's babesia, if I would have just looked at parasites, that would have been so easy to look for, not to treat, but it is. It's pretty cool how the body works.
It's kind of interesting. I start to think about, like, maybe what some people would consider excessive testing, but then, like you said, sometimes, like, I decided not to look at that. Is like, this is one of the things I think is the hardest piece here is, like, people are doing either a ton of testing that's kind of like spray and pray, if you will, and then there's people who are like, I'm only going to do, like, these few things and just guess.
Mm-hmm.
Can you talk about that a little bit, like what you're doing? Because it sounds like you're not nothing and you're not everything.
Exactly. And guys, you have to listen to that. What I have found, even when I first started to get into integrative medicine, is that whatever you test, you need to know how to treat. But more importantly, not everything you test is going to be the cause of that person's symptoms. No, it's not. So I can get a patient who might have an abnormal XXX test, like 5 of them, but then the question is, does that person even suffer still from that? Or is that something in their body that they've had for a long time and something else has caused it to come to the forefront and be more active? And that's what I tell patients. I'm like, look, I can have you spend all this money in testing, or we can just direct our test, like, a toxoplasmosis test or an oral microbiome test, and be more focused, or a perianal exam, or I can touch you, or I can see if you have POTS, and I can do a physical, like you said, look for these rashes, without necessarily just always having all the data in the world. Because I think data can be helpful, right? And sometimes we need it when we get stuck, but I think you can't say from the data that that's the only reason you have this problem. You still have to be a clinician. And that's one thing I even focused on yesterday, right? It's like you have to balance, because the testing, a lot of them aren't covered. They're not free. And we're limited. And we're always expanding, and we need it, but we also need to touch people and be doctors.
Yeah, and listen, I think so many people forget the fact that we're actually trained to have a conversation and turn that into objective information. like you said, like even virtually, you can see somebody running around, the kids running around in the background. You know, you can have them do the finger nose stuff, like, you know, hang out, you know, have them do Mr. Miyagi and get that fly that keeps going around here with the chest. Like out of the blue, I'm like, all right, shoot. But like,
or looking at Bell's palsy, or, you know, just obvious from conversation.
Right.
Hearing how that person might, you know, talk, or have them even do Romberg, tell you how to stand up and see if they're flapping. You know, there are things you can do virtually as well. And sometimes when I first got into functional medicine, I said, let me see how many patients that I can diagnose. Of course, I need to my test for infections, right? Without having tests. That's always how I think. Let me see how many people and how much I'll be on. And then I'll try to compare it. Not say we're brilliant, right, and we get everything right, but it's really helpful. And I especially use the test when I get stuck. And I'm very focused on what test I will use. Like, for example, my SPECT scanning. I might have, you know, patients who get discount SPECT scanning because I'm stuck. Like that patient I talked to earlier, like what else am I missing?
Yeah.
So we might invest in that versus same amount of money in just regular testing that may tell me a possibility of about 7 things that are going on versus let's look at what's, very pointed in anatomy and a person, because that's when you first learn medicine, looking at the person.
Yeah, right? Like, we are actually treating people here. And not Lyme and not mold. We're treating a human being who happens to be exposed to them. And
But we do need tests. Don't leave this interview and say, Dr. Cornish said no testing is needed to your doctor. Tests give us answers, and they are appropriate in some cases. But what I'm saying is you don't need across the board a standard amount of testing you draw for every patient you see.
Right. No, I love it. And it's like interesting, like, your friend reminded me of like training with Charles Ray Jones. You know, we talked all the time. Lyme disease is a clinical diagnosis, and we support it with our lab data. And what I learned in medical school is like the third day, I think, they're like, look, when you do a test, it either confirms your diagnosis or will change your treatment because now it opens up a door to something that you weren't focused on before.
Yeah.
Or maybe it's a vitamin D level and I've got you in supplementation now, it's too high, so I bring it down, or it's still too low, and now I start looking at other fat-soluble vitamins. But it's like our test should have an action plan associated with them before we get the result, before we even order it.
Exactly, and you can sometimes hear someone, oh yeah, I have a ton of metal amalgams, or yeah, I lived in a water, damaged home, my basement was flooding, and this and that, and you're thinking, oh, mold illness, well, you may not necessarily just only need a urine test. You can hear the patient's story and say, check, can I have like checklists and questionnaires I ask patients?
Yes.
And it really helps me kind of at least get a differential diagnosis. And like you said, use the testing to confirm it. And not necessarily say, and that's what I see a lot, oh, your tests are negative, like with Lyme disease and co-infection. So that means you don't have it. And like you said, it's a clinical diagnosis in a lot of these patients.
Yeah, and then they're like, oh, it's all in your head. And you're like, what, maybe. That's what I love about the SPECT scanning, too. It's like, you can be like, well, hey, this is more likely going to be some active driver of inflammation rather than, like you said, like a TBI or something. So it's like, or some other finding. And we're also not missing other things. And you're like, wow, okay, lab testing was negative, clinical suspicion very high, SPECT scan drives me in the direction of maybe doing, like, this might be an active infection. Let me dig deeper. Maybe I need a follow-up test, or maybe I need a therapeutic trial treatment that challenges them, followed by testing because their immune system was suppressed.
Exactly. Or even when you know, okay, there might be other causes of toxicity, like, ooh, maybe that's when I test. Like maybe there is a mold, or is it a metal piece? Is it more things in the environment? Is it a gluten piece? Like that's when you start testing, when you're trying to figure out, when you're dealing with someone with very complex neurological changes, and you're like, it's about prioritizing.
Right.
Because we can't do everything at one time. So you say when you get those, okay, this is how I can possibly prioritize my treatment and what I'm going to look for. And like, I love one thing about you is like, we also pull back the layers of the onions one at a time, right? We stay focused, we try to get that down, and we might take baby steps when it comes to dosing things and to see how a person reacts, but you can't do it all at once. So you gotta stay focused and try to your best, right? That's what we do. We all try our best, but we try to remove the layers back. Cause, you know, if someone said they knew everything about what we're talking about, I would run away. You know, we learn every day. Like, I go to conferences like this, and I learn so much. And I'm like, let me add that to my arsenal too, all the time.
You know, one of the things interesting to me is, well, you'll see where I'm going, I think, in a second, but it's like, how do you apply, like, you're at this amazing MAPS conference, right? Spring 2024, amazing presentations, but there's so much. And, like, I just am thinking about, like, when we go back on Monday, we're sitting down with our patients, they are all over the internet trying to figure this stuff out because it's so complex, which I think often distracts from their ability to get better because, so what I was wondering is, like, how do you as a physician who's got training in how to boil all this down and then sort of land the plane, put the rubber on the road, if you will, take this theoretic knowledge and put it into clinical practice when you go to a conference and there's 180 billion different things that you just learned and there's all these tidbits where you're like, hey, this, you know, like, how do you know that this is the thing for you to focus on now, and how do you know what to use with your patient?
And that goes back to one of the iLabs conferences we had a few years ago where it's like, what can we take to the bedside after we leave this conference? Yeah. And it does get overwhelming. And what I find is, one thing I like, especially at MAPS, is that they have a lot of outbreaks with clinical presentations, right? So you might hear your patient at that clinical presentation, and you're like, I didn't think about using that. That might be a good approach to take. That's when you're like, oh, maybe I need to test that. So it's like I base it on each patient. I take the tools and the knowledge, and it is a lot. You can't apply every lecture day one. These people are brilliant. These are like geniuses. And everyone, especially here, I respect so much. They do a great job, you know. And that's why I was like, why am I here? Like, how did they choose me? Yeah. But at the end of the day, but at the end of the day, you do have to organize your notes and then look at your patients and see what may apply. But you can't do it all overnight. So I kind of like that ability to look at it and say, does that apply? And most of the time I say yes to everything. But it's just really kind of, that's when it comes again to prioritizing and taking one step at a time.
Yeah, you know, and it's like, I think about we have an objectivity because we're not the patient. Yeah. Right? And there's so much, but it's like, I love what you just said, you can't do it all. At least not right now. Yes. And maybe we have to go through this. But one of the things I found, and I'd be curious how you feel about it, is it's not just knowing what the treatment options are, but it's actually knowing what order to do them in, which when you start to compare yourself with other patients, you may all need the same treatment in a completely different order. Or maybe, this is crazy, we don't all need the same treatment, right?
Don't you love that? Because we both treat so many families and friends. And I always hear them, you gave X this treatment, but does that apply? And it's like, no. You have a different genetic makeup. You have other things that might be going on in your life. You have other things you were exposed to. Even though you all are together, there are probably differences in how things apply to you based on how your genetics are, what other issues are there, your inflammatory burden. So I love that I tell people, I don't have protocols. You're going to just get, based on what I see with you, it might be different than the next person who comes to my office after, because I'm going to try to uniquely tailor. And I love, it was one conference, because I've learned so much with you. You said I'm a specialist, but I'm also a generalist, because we see everything, and we can't really get stuck in this box of saying X, Y, and Z for everyone. You really got to make sure it's tailored to those persons.
Yeah, and it's like, I think one of the things I think about, too, is just like, I have expertise, but I don't consider myself an expert. Because to me, an expert means I went like this, I put my blinders on, and maybe I'm not looking at everything for somebody. Like a case that I remember so well, I had a mom and a very young boy. came from Florida to see me, Lyme, mold, MCAS, kid had eosinophilic esophagitis, like really crazy stuff going on. Got so much better with treatments, and then mom referred her husband, and he comes up, he's got joint pain, brain fog, and fatigue. And I was like, what's going on? And he's like, well, you know, I got Lyme disease, or at least that's what my wife thinks. So, and I go, what happened? He goes, I went to my primary, and they did a test, and they said, you don't have Lyme, and there's no Lyme in Florida.
Right.
I said, did they do the rest of the workup? And he's like, what do you mean? I was like, well, were there any other labs? And they're like, no, he just did that one and told me to go away. And so I checked his TSH, and it was 97.
Exactly.
And I'm like, so we're just because we have an expertise, like I don't think of you as the only thing you do is toxin or strep and Bartonella or speck skin,
right.
But they're tools in sort of that generalist person's toolbox because you're a physician first.
And that's what I tell patients all the time. I have this little graph I show in my office. And I'm like, okay, there might not be a protocol. We have to take a lot of different steps before we just jump in and you leave my office with like antimicrobials for what you think is just only your diagnosis. Because I mean, it's hard because we wear many hats. Just like you said with the thyroid, you know, I always look at the hormones. I look at the male sex hormones, you know, because that's the key. We look at the adrenals because those help you if they're not stabilized, or sleep. Little baby things people think. Like, how am I going to treat you if you're not sleeping, or you might have leaky gut or irritable bowel, and the things you're taking may not be absorbed. So you'll come to me with maybe 50 supplements, and then we'll do a nutritional study, and half of those supplements are just going out of you. They're not being absorbed. So I look at the basics. If you're not sleeping and your gut is kind of imbalanced, it's like, what am I going to do? Like, will my treatment really work? And that's, people don't get it. And it gets so frustrating. Sometimes people are like, well, I'm here for Lyme. And I'm like, well, you're not sleeping. And you're eating McDonald's. And, you know, you're doing this. So I tell patients, I want to give my best shot at working as hard as I can and not have sabotage. Because it's a lot of stuff we have to do. And we work really hard. Sometimes get it right, sometimes get it wrong, but we at least try. And you don't want people to miss that mark of, look, I'm going to try to get you right, but you got to meet me somewhere. We got to have a barter system.
Right.
And one thing I always tell, especially the kids, I'm like, okay, look, what do you want? Do you want to remove foods that are toxic so you can remove recommendations and supplements or pills? Or do you want to eat toxic foods and then your supplement and pill load gets bigger and longer because I'm struggling to help you because I'm competing against you? So I think that's really important that people remember the basics, like, you know, looking at hormones, looking at thyroid, looking at male and female sex hormones, looking at gut. But then you get stuck because now you're in a whole lot of things. And then those patients, they need to work with other providers, those docs, to make sure someone else is looking at that.
Well, I think, too, like, it reminds me when you mentioned a moment ago about prioritization. You know, we're trained to think about all these things and learn all these things and know what that possibilities are. But we're also trained in our differential and triage to, like, kind of narrow it down. So I think that that's one of the things that people in the general public may not understand is, like, yeah, we're considering, like, because I would have people that be like, oh, well, because they come in like, I want the Lyme treatment. I'm like, well, you just labeled yourself, and if you want Lyme treatment and you're not willing to treat you, you're not going to get better. But the other ones are like, I want to do everything. I'm like, well, that's not always reasonable either. And it's like the doctors and all the other people on our healthcare team have been trained to streamline it.
And that's why I say, you say, I'm not just a specialist. I'm a generalist. I'm looking at you, your entire body, because I can treat the Lyme, I can treat the Bartonella. Oh, yeah, we can do this and that. We can treat the toxoplasma. But if you're not sleeping or eating right and you're, sedentary, it's just hard. It's hard. It takes longer in those cases. Right. And then you have some people who are 100% committed and then still frustrated. And that's where you and I, we look outside the box. And then we try to find those other things that might be going on. Because like you said, it's not in their head. They need some help.
It really is. What else is going on though? Like are there any other kind of spots that you've seen, like really like shiny areas where you want to pursue or,
Man, it's so many. I mean, I
That's like a
would
loaded
put it all
question.
in there. Somebody's like, what did she say? I mean, it's such a loaded question. I'm just always looking for things, either hit or miss, because I know if a person is stuck. It's my job to kind of try my best. And then some days I'm like, oh man, now I look here, now I got to do this.
No.
So that's what I mean going back to testing. You test what you can treat. Because if you get a whole bunch of things, just like you said with prioritization. So, I mean, as far as new things, I'm doing more, of course, more Jellins patients, like the brain scans that we've talked about. I'm doing a lot of brain imaging, the mouth. And then who knows what's next for the Cornish? Who knows? So the body is complex and beautiful at the same time. And we see the most challenging patients, because I don't know the last time I saw an EM rash. I don't know any time I've been the first Lyme specialist or the first doctor. I can't even remember if that's happened in the
can't
last
remember
12
not
years.
being number 30, right? You're
Right.
like, shit.
You're like, oh man, so you really got to start learning. I think that's what I appreciate about you. Like, they say you can't teach an old dog new tricks. We're always looking for new tricks because we don't have the answers for everything, and we just try our best.
Right?
Yeah.
I love it. That is so great. So I appreciate you spending your time chatting about all this. I always get so excited when we're going to get together and really want to do it in person because there's so many virtual interviews. But being able to hang out and educate others together and learn from others and then powwow about what we think about what we heard is just always such a gift. Where can people find out more about the work that you're doing?
Yeah, so my website is www.amenclinics.com. I just got fancy and got on Instagram, so it's dr.ebonycornish. And then I'm starting a 2-week neuroinflammatory intensive program where people can travel, they can get their brain imaged, they can get all their antibiotics that they needed or IV infusions, get all their testing for infections and done before they arrive, and have a nutritionist. So they come here and they're like, this is what you eat for these 2 weeks. And then they go back home to people like you after they're kind of supercharged. And so I'm doing that at Ava Clinics as well. And that's like my new baby. That's like it's starting in April. I've worked so hard on it. And it's like almost being delivered, but it will be April. So I'm so excited.
Awesome. Well, it sounds like perfect timing, as you may hear the crowd is starting to, make some more noise and get a little rambunctious around the corner. But yeah, definitely. I will make sure that we have all the links to getting in touch with you and your blossoming Instagram accounts. So make sure everybody go head over.
I know blossoming, but it's
let's
there.
Let's blow up Ebony's IG. And then let's also, we'll put some links to your program and talk about that. And then maybe later on, as that's going on, we can get some more updates on that, share with everybody. So,
of course. You're my friend. And whatever you ask me to do, you want me to talk about something, I'm there.
Well, I appreciate it. And the thing I know about you, Ebony, is you're there for your patients, just like you're there for your friends. And that's like the most amazing thing. And some of the other things that, I know I'll when we record the intro and everything to do later, iLabs, Amen Clinic, just like the accolades and the positions of service that you're in are incredible. And just want to say thank you for taking the time out to be with me and then also to share with our audience, because you are one of the most dedicated people I know. And one of the most science-based, rigorous, as well as sort of thought-provoking, thought-leading people out there. So it's kind of like this combination. There's a lot of people who are talking a bunch of BS out there. And you're science-based, so I really appreciate that. And your compassion, caring about the patient, and innovating whilst being part of that. So, I learned
from you.
So much.
You're my hero, man. You taught me a lot. Seriously. I was telling you earlier, when I saw you back, I guess, when I joined in 2010, one of my first ILS conferences, I was like, he is awesome. I want to learn. No, honestly, I respect you so much in what you do, and you've inspired me in so many ways. You have no idea.
And right back at you. So, thank you so very much for being here.
Of course. Thank you for having me and pulling me to the side. I love this kind of stuff.
This is amazing.
Well, there you have it, folks. Thanks so much for joining us for this episode of the Lyme Insider. And such a big heartfelt thanks to our special guest, Dr. Ebony Cornish. And as promised, we took that deep dive into toxo. We talked about spec scans. And most importantly, we looked at how there are researchers, physicians out there who are really thinking about this outside of the box and bringing it back to the science. This isn't just, mumbo jumbo. Somebody thought it sounded cool and they could market it to you. No, we're talking about real science is making real results and real changes in real people's lives. And that's the most important part. And I was just blown away how, Dr. Cornish went outside of our normal thinking pattern to really just dive deep into what is this IgG of toxoplasma mean when we're, in for all of our folks who it's just coming up and a lot of people just push it aside. She dove deeper. She looked at the research. She looked at the treatment approaches. And then she even looked at what we could do with SPECT scanning to help us understand, is this just a persistent IgG or is this something else? And then looked at all the different places where we can access healing for you and your loved ones so you can get better quickly. So this was just such a treat to chat with Ebony, and we've been friends forever. She is someone who's doing such great work, including being on the board of iLabs and doing all this work at the Amen Clinic. So we're going to put a bunch of information down in the show notes so that you can connect with her if you need to. She's got some amazing programs, including a new Jumpstart program where she's doing kind of everything you need all at once in 2 weeks at the Amen Clinics, and then getting you prepped to go back home. And so many times what we're doing is we're always trying to treat something, but more importantly, it goes back to one of my favorite quotes ever. James Thurber said, "It's better to know some of the questions than all of the answers." And that's really what Dr. Cornish does. She makes sure that we find out what is truly the problem, what is at the core of the issues that you're experiencing, so that then you can get better. Because there's a whole bunch of treatment protocols out there. There's a whole bunch of natural things, a lot of medicines, but if we don't know what's really wrong, then how can we get better? And that's really what she's so good at, because she knows how to get you better, right? But she also knows that she's not going to be able to know what tool to pull out of her tool belt or her toolbox until she finds out what's going on. And that's what I love so much about Dr. Cornish. And I'm just so, as I said, eternally grateful for her for joining us, sharing her wisdom. I'm sure she'll be back with us. But anyway, that's what the Lyme Insider is all about, getting these groundbreaking researchers and clinicians in front of you so that you can hear the way they think, see their passion, and know that both they and I are here for you to help you get better. So enjoy this episode. Please subscribe so you can get the notifications when we have our next episode live. And until next time, just live your best life and lots of love.